Your healthcare costs are probably going to skyrocket next year. I want to tell you why this is happening and what I'm going to do to try to stop it. To make sense of this, we got to go way back in time to 2010 when President Obama signed the Affordable Care Act into law. Part of that act was to create a marketplace for those individuals who couldn't afford healthcare coverage. But still, even with that marketplace, there needed to be additional tax subsidies put in. And even with those subsidies, a lot of Americans still couldn't fully afford healthcare. So in 2021, the Congress, led by Democrats, doubled the subsidies for the marketplace. And it really worked. Instead of 12 million Americans buying through the marketplace, that number went up to 24 million. Having more people covered meant that there were less people going to the emergency room. That brought overall healthcare costs down, even if you have your health insurance through your employer. Before the expansion, only about 36% of eligible folks could actually find a health insurance plan for $10 a month. After the expansion, 80% of the eligible folks could find that cheap plan. So now, about 24 million Americans get their health insurance through the marketplace. 9 out of 10 of those 24 million receive part of these expanded credits. You'd think that's great. We've made progress. Wrong. Now with the new administration, they want to eliminate virtually all of these subsidies. That will mean up to a 75% increase in your healthcare premiums. 75%. That will be devastating. Millions of Americans will lose health insurance. So what does this mean in terms of real families? If you're a low-income family making, say, less than $32,000 a year, your healthcare costs now range roughly around $50 a month. Without the subsidies, it'll go up to almost $800 a month. Folks can't afford that. We'll see about 4 million Americans immediately lose their health care. That number will probably go up to 6 or 7 million people by the 2030s because people just won't be able to afford it. Now, some of you be saying, I don't get my health care through the marketplace, so I'm going to be fine. No. As millions of these people don't receive health care, they're not going to disappear. They're still going to get sick. They're going to overwhelm the emergency room. They're going to drive up hospital costs across the country. Those of us with private health insurance, our rates will go up as well. Now, we all know the political reality. We got President Trump, the Republicans control the Senate, Republicans control the House. There aren't many places where we have leverage to push back. One of the places we can make that fight is around the government funding fight. I know a number of Republicans realize they may have gone too far. They've got to work with us in a bipartisan fashion. We can get this fixed, but we've got to hold firm. I'm going to do whatever it takes to win this fight. Your health care is worth fighting for.